Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston, and I'm answering today's patient question to discuss skincare. So obviously I could be here for hours talking about skincare, and I certainly do not consider myself the world's expert on skincare, but I thought I might break it down to one topic related to skincare, which a lot of patients ask about, which is retinols or retinoids or retin-A. What are they and should I use those? So let's just talk about terms. Retinoic acid or retin-A is a prescription strength product that is used for the skin that can actually have significant beneficial improvements, improve quality of skin, fine lines, texture, brown spots, etc. It's a pretty aggressive treatment. You do need a prescription for it, and it's applied typically at night, and one uses it a few times a week, and your skin builds up sort of the ability to tolerate it. Retin-A, which a lot of people relate to teenagers using for acne-prone skin, that is true, that is used to help improve skin that has a tendency to be acne prone, but adults can use it for a cosmetic improvement as well. I instruct my patients who are willing to use a retin-A to really kind of accept that it's going to take some time for their skin to benefit from the procedure, from the treatment, but then also take some time to actually get used to it. I do think it takes about 3 months to ultimately see the benefits of any type of retin-A, but also it can take several weeks for your skin to get used to it, just like an exercise. So I suggest that my patients use retin-A at night after they wash, and maybe 3 times a week at most, and have your skin get used to it. Symptoms that patients complain about or associate with initially treating themselves with retin-A are as red skin, dry skin, very itchy. And just like going to the gym, some of it is just you gotta kind of push through it and tolerate it, and your skin will benefit from it in the long run, but it can take some time to experience the benefits of that. And that I don't think that treatment is for everyone. People who have sensitive skin might not be able to tolerate that, and I get it. So what's another option for that? A retinol. So a retinol is sort of a derivative of a retin-A, and ultimately a retinol is turned into a retinoic acid at the cellular level of your skin. Retinols are in products that we sell in our office, but then also in products in pharmacies and beauty stores. And these are great products that actually you can make a fairly substantial change in your skin. I do think some people argue that ultimately retinols create the same result that a retin-A would result in, but it just takes a lot longer to do that. So again, the benefits of a retinol versus a retin-A, or in addition to a retin-A, I should say, are improved fine lines, improved texture and quality of skin, improved brown spots, and just overall rejuvenation. So what should you look for in a retinol product? First of all, not a pro-retinol. I do think a pro-retinol is probably not so worthy of your time, but a retinol for, say, sensitive skin, where there's a lot of products that are sold at the pharmacy, and I think that those are a good ways to start. Just like retin-A, you want to kind of have your skin get used to a retinol product. I do suggest it's used at night, and it should be the first thing to touch your skin after you wash and before you apply any other additional moisturizing lotion. Some people should also use a retinol maybe 3 times a week and have their skin get used to it. It can be used all over the face. I do think that retinol products can even be used underneath the eyes for the skin underneath the eyes, which is very sensitive, which I don't always recommend retin-A to be placed on. It can be argued whether a retinol or even retin-A increases your sensitivity to the sun. I tend to recommend that patients just be very good about using an SPF and avoiding exposure to the sun, which I kind of recommend to anyone who's concerned about their facial skin anyway. So again, today's topic is kind of aspects of skincare. And I highly suggest you consider a retinol product or ultimately even a Retin-A. I would speak to your board certified plastic surgeon or dermatologist or core cosmetic physician about that and to get proper guidance. People who should not be using retinol or Retin-A products are patients who have extremely sensitive skin. It could be argued that patients who have rosacea should not be using retinol or Retin-A products. Women that are pregnant or trying to get pregnant should not be using those. And I do think it's worthy of a discussion with your skincare professional to start kind of a good regime. But these days when people are at home, starting with a retinol is a good way to go. All right, I hope that was helpful. Please look for me on YouTube, Instagram, and please keep sending in those kind direct messages and questions. I hope you're all doing well. I miss you very much. Stay safe, and I hope to see you soon.